Welcome to the Six Hats podcast, where I, Dr. Shami, a lifestyle and nutritional medicine family doctor, will talk about how women strive to find balance each day by juggling their six roles, being a woman, mother, daughter, partner, business owner, and professional. Hello, everyone. Welcome back to the Six Hats podcast. And today we welcome back Steffan Cavalera. He's a physiotherapist at Kieser. And in this episode, we're going to dive into the common issue of lateral hip pain in women over 40 and explore effective strategies for prevention and management. So Steffan is an experienced physiotherapist at Kieser, and he shares his expert insights on why women in this age group are more susceptible to hip pain, the role of muscle imbalances, and how lifestyle factors contribute to discomforts. So we discuss practical exercises, tips, lifestyle adjustments that can help reduce the risk of lateral hip pain. So welcome back, Steffan.
Thanks, Shami. Thanks for having me on again.
Amazing. So, Steffan, I think a good place to start is lateral hip pain. And it's really interesting when you approach this subject, I didn't really think about it. And then it suddenly all settled in going, actually, you're absolutely right. Women above the age of 40 are presenting with hip pain. And I never really connected the dots with hormonal changes, a specific age group. So yeah, what is lateral hip pain?
So if we're looking at the outside of the hip where the greater trochanter is, so that bit of bone that you kind of press to on the hip, it's a site of tendon attachment or muscle attachment of your hip abductor muscles. And those are the muscles that keep our hips level when we're walking and running. And they're also a site where our bursa is. So a bursa is like a fluid-filled sac, and it helps facilitate load. So it helps with movement and compressive forces. So some people might have already heard the term bursitis. Often people get sore shoulders and they'll be told they've got bursitis there. So lateral hip pain is a combined diagnosis of tendinopathy and bursitis, and it tends to come as a result as an increased stress on those tendons that attach at that bony protuberance at the side of the hip.
Amazing. So why do women over the age of 40 tend to suffer?
There can be a few different reasons. It tends to line up with perimenopause. So often you can get hormonal changes at that time, weight gain, potentially a drop in your estrogen levels. And tendons are mostly collagen fibers, so tightly packed collagen fibers. And estrogen affects the ability of those fibers to proliferate. So if you have a sudden change in load, if you've increased weight, if you've decreased your activity dramatically and you're sitting for long periods, or even if you increase your activity a lot, if you go from walking 3 kilometers up to 6 kilometers, that sudden change in load on the tendon can irritate it. And it can also then cause friction on the bursa. So we get a bit of an inflammatory response.
Amazing. So if we could take the listeners on a journey of someone maybe deciding to start exercising. It's the new year, deciding to start to exercise. Is that what you see? So, when you suddenly haven't been exercising and you just decide, okay, I'm going to go to the gym now, I'm going to carry heavy weights. What do you see in that journey of someone presenting with hip pain, lateral hip pain?
Yeah, exactly right. So probably the most common is when someone increases their walking duration. As I said, you've usually walked 3 kilometers after a working day, but then you shift to walking 6 kilometers, or you try going for really fast-paced walks and hilly walks. So it's just that sudden increase in the load in the tendon that doesn't necessarily result in pain from one walk or one weights training session, but accumulates over a period of time. So it ends up being, I was a little bit sore after my first walk. Then a few weeks later, gee, I'm really sore. It's not really that sore when I'm walking, but afterwards, and particularly at night when I lie on my side, it's sore. And then it obviously gets to the stage where clients present to a GP or a physio with the issue. It can also happen with gym work because, again, people might get a sudden increase in load. So they've got that initiative in the new year, or they're at that stage of life where they gain a little bit of weight because of hormonal changes, and they start lifting weights that are a little bit above what their capacity is.
Wow, that's so interesting. And so the journey can take a couple of months before you see the full effects of pain, and as a result, you start seeking help. And so I would love to go back in that story and go, what can women do? How can we be mindful of it? So is that something that we need to be aware as we approach 40, going through perimenopause?
Yeah, I think certainly when it comes to lateral hip pain or tendinopathy, the underlying factor is a weakness within that muscle and tendon. So if you're going to be embarking on a exercise journey, whether that's gym, whether that's walking, it's probably worth doing it very gradually. Don't go from not doing gym for 10 years to start, working absolutely as hard as you can and doing 5 sets of weighted squats. It's probably a bit too quick. If you are someone who's had an injury in the past, it's always worth just getting a bit of a screening, whether that's with an experienced personal trainer or whether it's with a physio. If you've had niggles, that could be a good chance to say, hey, I'm going to start doing gym, or I'm going to start walking 10 kilometers a couple of times a week, just to get a general screening. But otherwise, your safest bet is always a really gradual increase in whatever load you're putting yourself under.
That's amazing. So what I'm hearing is, so if you haven't worked out for a long time, go slow off, and it's actually worth getting a proper assessment of where your body is at this moment, and working with someone like yourself to actually create a plan of where you want to go. And I always actually advise my patients it's important to seek help and professional help, because going into the gym, it's actually quite confusing, intimidating, and you actually may hurt yourself if you don't know what you're doing. And you've described it really well. It's all about that gradual improvement in terms of weights, because we can often be misguided by maybe what you see in social media or YouTube, going, wow, I can do that. Let's just go and do it. What do you say about someone just looking online for guidance?
Yeah, I always throw caution to the wind there, because I think when you're in your 20s, you're indestructible. Like if you haven't played a sport for a while and you go play a match, you'll probably be okay afterwards. As we age, when we're in, your 40s and 50s, our body can't tolerate what it could tolerate years ago. So it is definitely worth just being mindful that, a YouTube exerciser and an Instagrammer who has a routine for strengthening glutes probably won't match up with your capabilities, which is why getting guidance to say, hey, actually starting with these exercises would be appropriate. These are your weak points. This is what you can focus on. This is something you might lack in your technique. So for females in particular, they're often susceptible to lateral hip pain because they have a wider pelvis. So with that wider pelvis, it increases the compressive loads on the outside of your hip, on those tendons and the bursa, if you're doing squats and your knees are poking inwards. So just having someone give you that information and say, okay, if you're going to do squats, this is the way to do it.
That's amazing. So you've actually mentioned a couple of things, for example, lack of activity and then starting a new activity, increasing the intensity. But also I want to explore, and it's really important to discuss, like you, I see so many patients having desk-based jobs. So they're sitting for long periods of time. And I'm talking 8 to 10 hours, and sometimes, a couple of hours of not even standing because they're so focused. What impact does that have on our joints and especially our tendons?
Well, if we kept it just at the hip, I know there was a theoretical study done over a decade ago that looked at the structure of the hip and the ligaments around the hip. And it concluded that we're supposed to walk about 12 to 14 kilometers every day. We are not designed to sit down for long periods of time. I know I don't walk 12 to 14 kilometers every day, but it just goes to show that, we're not designed to be at the desk and sitting for really long periods of time. And if we look at the tendon on the side of the hip in that area where we have a few different tendons converge and we have the bursa there, if we're sitting, there's actually a load on those tendons, and our body, our joints, our tendons, everything in our body likes movement. It doesn't like being still for really long periods of time. So if you're sitting and your legs are crossed, or again, if you're a female and you've got wider hips and you're sitting with your knees together, that's going to increase the compressive load on the bursa at the outside of the tendons. So it is worth getting up, moving, breaking up your sitting time. I mean, there's so many other additional benefits to getting up and moving. There's been studies done on memory recall and brain function and getting up every half an hour and doing 10 squats. I know it can be quite difficult. We all tend to get tunnel vision when we're at work. We want to finish this task. We want to get everything done. But it's better for you physically and mentally to break up your sitting time and get moving.
That's amazing. And I want to add on a few more benefits. And one of the biggest one is obviously osteoporosis prevention, just by standing every 30 minutes, not sitting for long periods of time. And I think there was this neuroscientist from NASA and she wrote a book, Sitting Kills, and it's Jean Vernicos. And she just compared what astronauts experience because that's what she was studying. And she realized they experience the same harm from being in space without any gravity. So there was no muscle build compared to, and she compared it to sitting for long periods of time, and the exact same issue: loss of muscle mass, loss of bone, insulin resistance, weight gain. So it was phenomenal. And you're absolutely right. It's so easy to stay focused. I know I've done it. I'm going to put my hand up. I think it was during the restriction time where we just switched to telehealth. And I suddenly realized I was sitting for 4 hours doing telehealth and I didn't feel great. It wasn't great. And now when I really think back, wow, what an impact it has had on so many aspects of my health because it's so easy to do. And I see a lot of patients who actually find it hard to stand and sit and get up. And I always say you can actually create an environment of movement. What suggestions do you have for patients who are sitting?
Probably a timer on the phone's the easiest. Just every half an hour, get up and do 10 squats. Other things would be around movement in between meals. So making sure that, after you finish breakfast, before you log in, go for a 10-minute walk, have lunch, and then get up again and try and walk around the block. Finding those opportunities to move, and whether you need that prompt with a note on the side of your computer saying squat, a timer, I think all those things can help. And for everyone, you just need to find out what works. We all respond differently to different strategies. I know for me, I actually adopted the squatting in between clients.
Love
So
that.
I try and just do a few squats. So that way, when I'm talking to people, I'm not just going from one client to the next, sitting on my bottom, like you said, for 8 hours of the day. And what you said around, osteopenia, this really is the age bracket that you have to be mindful that you are potentially susceptible to osteopenia and osteoporosis, and loading, movement, strengthening are really important. So for that person that's coming in with lateral hip pain, that might be that perimenopausal woman, I would talk about just in general, what can you do to help? Can we get a strength training routine that you do a couple of times a week? Because you need enough of a stimulus to actually strengthen the tendon and enough of a stimulus on the bones to actually make a positive effect on your bones.
That's amazing. And that's where I really want to lead on to. So if someone comes to see, they're already in pain, they've seen the GP, they've had perhaps some imaging, and you've assessed. So how does that start? What does that journey look like?
Well, for my assessment, first I'd look at the way they walk. So typically for these people, if it's their right side that it's affected, when they start walking and they land on their right foot and swing their left foot through, their left hip drops, because the role of these tendons and muscles is to keep your hips steady. So either their opposite hip will drop or they'll shift their weight, their torso will lean to that right side to try and offset the load in those tendons. So that's my first telltale sign. And then I'll go through a battery of tests. So I'll stress the tendon in different ways and I'll see if it's pain provoking. I'm lucky at my work, we've got specialized equipment. I can actually strength test these muscles, and I can pair clients to another group of females or males, because males also present with this issue. It can happen often with runners. And I'd see where they are against people in their same age bracket, same sex, same weight. And if they've got a real deficit there, that bit of information can be really powerful. If you're in the 10th percentile, the bottom 10th percentile, but you want to be walking 6 kilometers every day, then we need to get you well above that 50th percentile in your age bracket. And when it comes to treatment, again, I'd go back to strength training. So there's passive therapies that I often utilize. Often these people are quite taught through the muscles on the side of their hip and the tissues on the side of their legs. So I might utilize some dry needling, some soft tissue massage. That can be good to kind of facilitate normal movement. But the main strategy is I have to strengthen those tendons, because anything you do to reduce pain might be good in the short term, but in the long term, if those tendons don't improve their ability to tolerate load, then you always get back to that point of when I walk this far, when I sit this long, when I go upstairs, I get pain. But we have to be really deliberate with how we strengthen that area, because if I challenge that person too much, they might be sore for 3 to 5 days. And then that pain will further inhibit their strength and it'll spiral into I'm sore, I change the way I move. Some of it's conscious, some of it's very subconscious. We kind of become maladaptive in our ways to avoid pain. So I need to hit an intensity that's going to challenge them, but I know they can recover from within a couple of days, and then just very slowly, progressively overload that tendon. And that's when I'd start to look at the whole picture. I'd have a look at the muscles in their trunk, their core muscles, their leg muscles, and see where do the deficits lie.
And so, if we could give a picture of what that looks like in terms of strength training 3 times a week, so how long would a session look like?
It depends on the person. So if someone's new to exercise, I might just start with one hip exercise and then one exercise for their core muscles and one exercise for their legs, because I want to make sure that they recover after each session and we don't start creating problems where there weren't any. If they're reasonably active, they walk regularly, they've done some Pilates or gym work in the past, then I might challenge them a bit more. We might go through just a couple of hip exercises and then look at, the chain, the leg, the core. It's not necessarily how many exercises I'd get them to do. It's the quality and the focus that they have on those hip exercises, because some exercises are easy. If I get you to do a bicep curl, I think most of us with a light weight could do a bicep curl really easy. But if I get you to stress those tendons on the side of your hip, if you've got pathology there, your body might tense up everything else to compensate except that muscle and that tendon. So yeah, I'd really be starting with minimal exercises and building it up. And each session, if they've recovered from their previous session, then I'd increase the load. I might increase the complexity of the exercise as well, but I want to build it up to kind of a full body routine. So that way we're not missing the overall picture. Because if they've got pain on the side of their hip, I'm sure there's other contributing factors. There might be, as I said, weight gain. There might be a weakness in their core muscles from being inactive a lot of the day, sitting down. So I'll start to address the whole picture slowly. And the end result is I'd really like people to have a strength training routine that they do 2 to 3 times a week. It's targeted. Often the exercises we do for rehab are the ones we hate. So I'll try and make sure that there's those few rehab type exercises, and around that you can do the fun things.
And amazing. How long would that take in a set?
It depends how long they've had symptoms for and how irritable they are. So if someone's really irritable, then I would start with a really low intensity with their exercises to make sure that they pull up fine, that I'm not making their life any more challenging than what it already is. If they've just got kind of moderate symptoms that are a bit more challenging for me to provoke, then I'll challenge them early on. But I usually tell people, look, if you've had pain for a couple of months, which is usually what I see, often this pain, as I said, kind of builds up slowly and people ignore it. We all tend to ignore these little niggles that come about until they're too painful. So if it's been there for a couple of months, it can actually take 6+ months until it resolves. Yeah.
Incredible. And how long would each session be, just to give an idea of, is it 10 minutes, 15 minutes? Because one of the biggest questions I get is, I don't have time. And
Yeah.
so it's a bit of a negotiator. And I think you've demonstrated it really well of, how do we goal set? How much time can we give in the day? What else can we do? So how much time do your patients spend on each exercise, or like on an exercise session?
If time's a barrier, I always tell them that, look, you really only need to do a couple of half-an-hour sessions per week with targeted exercises to make a significant change.
Mm.
I'm really mindful that, often these clients have children, they're juggling a career, a family, social life. So getting people to go home and do
Mm.
15 different exercises isn't feasible. I think they're better off to actually go somewhere, do something that is challenging, and just get it done within half an hour.
Amazing. And almost like trying to fit into your day, make it part of your day. So there's so many strategies to start a new habit, but I think pain is a brilliant motivator in order to release it. So do you find patients find it hard to fit that in? How do you motivate patients to keep to that
Yeah, definitely. It's often an ongoing negotiation. At the end of the day, I can only give them my opinion.
Yeah.
And we can back that up with imaging. So ultrasound often diagnoses this injury, and we can see something there. And I often tell them, look, it's not going to get better on its own. If it's been there for a couple of months, if it's quite easily irritated, you're getting pain lying on the side at night, how important is this for you to get better? What are the consequences if we don't get this better? So the consequences might be that it becomes more painful. It affects your ability to sit for periods of time. It affects your ability to enjoy life and go for work. So with that in mind, like how great of a cost is a couple of 30-minute sessions per week? Yeah, it is really difficult because I understand if you haven't been exercising for a period of time, bringing that into your routine can be a bit of a shock, which is probably why I favor rather than big routines or something every day. You can do little things every day. You can get up and squat every day. You can go for short walks throughout the day. But when it comes to your actual rehab work or just general strengthening, just try and fit in 2 times a week.
Love it. Love it. It just makes it so achievable as well. Amazing. Thank you so much, Steffan. And before we let you go, any last words of advice?
As I said, I think prevention's key. If you're wanting to start an exercise program and you haven't done any strength training in a while, go and see a physiotherapist or an exercise physiologist. Get some advice, get a general screening. And if you're going to start a program, get some help with it, either, as I said, with one of those professionals or with a personal trainer, because the gym is a bit of a scary place, and exercise in general can be a little bit scary if you haven't done it for a while. And if you are getting pain, I always think if something's bothering you for 2 weeks, just go see someone. Some niggles do come about and they go away in a short period of time, but if it's been bothering you for 2 weeks, it's probably going to get worse over time. So it is worth just checking in with a physio, getting an assessment.
Amazing. Amazing. And what I'm hearing from you is to keep moving. That's what I'm hearing. Keep moving and avoid sitting for long periods for sure.
Yeah, 100%. And with that caveat with this group that get lateral hip pain, you want to keep moving, but you want to avoid what's painful. If going for really long walks is painful, shorten them, build them up slowly over time, reduce your gym routine if that's what's causing pain, and let the tendon and the bursa settle down. But yes, definitely, I think for particularly that age group, that perimenopausal age group, you want to be getting active, protect your bones, get strong, and lose weight.
Amazing. Thank you so much, Steffan. And where can people find you?
I'm located at Kieser in Collingwood, so we're at 370 Smith Street. We moved to that facility a few months ago, and it's been great. It's a really big space, and we've had lots of the Collingwood community come in and do their strength training routine there.
Amazing. Thank you so much for your time today. Remember that this is general advice only. Please see your healthcare professional for more information. So what's your take-home message today? Remember, it's all about progress and not perfection. And are you suffering from stress? Visit the Usawa Learning Hub on usawa.com.au for more resources on how to de-stress, re-energize, and reclaim your health. Enjoy the journey.